observations about the data?
Well, we started out, we're from DSHS, and we started out on our own little maverick path. I was looking at HRSA, and they were looking at ESA, Health and Recovery Services Administration and Economic Services Administration. They're fatter than we are.
Oh, go figure.
It was weird. No, it was weird. We picked out the same things that we were looking at, but 76% of the population at Economic Services Administration had a BMI that made them considered to be overweight or obese. 61% in HRSA, which I thought was interesting, but that's too much. And that's one that we concentrated on for all of our work that we were going to be sharing. We have a mean age of 45 years old, and thought that was interesting because we're middle-aged. And it seems like there's a lot of young kids running around. So maybe it's because the old people are sitting in their cube and not getting out. I don't know. And then the other thing that jumped out at us was the number of people that had no idea that they had one or more metabolic risk factors, so comorbidities.
And for number 2, in regard to what we're trying to accomplish, overall, the bottom line, we want to improve our biometric numbers, obviously. We talked about increasing physical activity, motion, just getting people moving more, continuing education about risk factors, because what struck us was how many people were newly aware of these risk factors they had. We want to work hard to engage employees in the process. We want to mention the grassroots efforts, specifically those in what they talked about, the pre-contemplative stage is what we were going to focus on.
And one thing that's interesting is that we have to almost solely rely on our biometric information because we can't break our HRA information down. And we're 19,000 employees.
Tell me about the report you got.
And one of our assignments was to bring our sick leave usage, so I contacted our Human Resource Department and asked them to share what they shared with the governor during the GMAT process. They said, be specific what it is you need, and I said, we need aggregate data. We don't want all of the CSOs, the community service offices. We don't want regional offices. We only want the people headquartered, stationed at Capitol View 1, Capitol View 2, and the headquarters for the Division of Child Support. And then we only want people housed at Cherry Street Plaza. And they said, that is not a problem. When do you need it? And I said, close of business Monday. So I'm ready to leave yesterday, and I get this email. 2,500 names, line by line, for 4 years. Days, literally, of sick leave usage. But they report this to the governor. So we've got a lot of hand counting to do, or we're going to have to go back and communicate a little bit differently.
Be spaced in at home.
Yeah. So consequently, we don't.
Okay.
Yeah, that was interesting.
We have a lot more to go on the absenteeism. Yeah, back to the drawing board there.
Yeah. That was funny. Yeah.
Okay, so the accomplishments, I heard 3 things. Just let me see. Just tell me here. One was to reduce. Is it to reduce obesity and overweight, or was it to increase physical activity?
Yes.
Both.
For
Increase physical activity.
Motion.
And then there was something about engaging employees. Or,
Yeah, engaging employees in our processes, in our development of the intervention.
Okay. So those 2. And then was there a third thing?
Well, the third, the overlying whole thing is to improve our numbers, our biometric numbers.
That's right. Okay. All right. So,
Okay. So for number 3, what intervention will you do? We listed several. One of them, again, we're going to keep repeating this, but we're going to survey our staff to get a better understanding of what it is they are interested in when we're developing our interventions. Because if we just sit in a room and develop interventions without their buy-in, then we're not going to be successful. So it's really important to engage them and get them involved in that process. So we're also going to look at bringing in guest speakers to talk to us about nutrition. One of them was like understanding labels, but I was really happy to see that in that book that we were given today of understanding labels. But Or about, good ways to eat and nutrition when you're like diabetic or at risk for being diabetic, just getting a better understanding of, what it is and how you should be eating. Also for exercise, bringing in guest speakers or, people who want to like do a class on like resistant band, because we had someone already bring that up that we'd like to be able to promote that in our area. We're also going to look at different equipment. Blood pressure cuffs, we talked about this at a meeting recently where we were looking for some input from you guys with regards to recommendations. So on those and scales and like ways to measure your BMI, those types of tools. We also want to, we've had a very successful program in one of our buildings, the bike checkout program, the bicycle checkout program. We want to implement those in our other buildings as well. Provide bicycles, locks, and helmets for people to take those out during breaks or ride across town to meetings and those types of things. Another thing is we're going to be working on our community linkages. We've already met with Terry Winslet from Thurston County Health on implementing the Live Well chronic disease management program within our department. So that's something we're working on. We're very excited about that. It's a 6-week program, so and it's free. They offer it for free.
I have a question. How are you? I know when we met with her, our problem was how are we going to be able to allow staff to have the hour and a half meeting? Have you guys came across?
Well, we are still in the process of presenting information to our leadership. So and I have a feeling we'll be successful, but we're still working on that.
What we're going to do is make a recommendation that we assign it a FERDIS code and track it as a legitimate training and have people register as a workshop.
That's awesome.
Can I ask about your bike loaner program? These
Yeah.
were bikes that people donated.
Yeah.
Did you have them go through a safety check, like take them to a bike shop to make sure that they were in good working order?
This guy that donated these bikes is really into bicycles. These are bikes that he's had for a very long time, and he takes care of them. He maintains them all the time, and if there's anything wrong with them, we report it on them. And so he's the one that takes care of that for us. So within the other buildings, we have to find out how that would work, but it's a very good
And are you also providing bike maps? I know there's some county.
That's something we want to work on, promoting bicycle and walking maps for people. So we're in downtown Olympia, and we're right on near the trails, the bike trails, the what is it, the Shyloh Western Trail, the
So there's
Woodlands.
a Thurston County. I also have a whole box of Pierce County bike guides, just because he knew I would live in Pierce. So I have a whole bunch of Pierce County bike guides.
Good.
If anyone's interested.
Cool. Thank you. We're also piloting a program called Dash to the Market. It's something that we've come up with where our offices are located about 4 or 5 blocks from Capitol Boulevard, and we're going to walk to Capitol Boulevard, catch the Dash bus, and ride down to the farmers market and look at the fresh produce and pick up fresh produce and healthy foods from the farmers market and just promote walking and good nutrition at the same time. And then, with the nutrition, we're also going to focus on promoting Energize Your Meetings. We already use that, as a lot of you know, in our health risk screenings. We've provided snacks from Uptown Organics that's catered our meal today, and it was very successful. Healthy potlucks, healthy recipe sharing, and really look at getting healthy vending brought into our offices. That's something that people are really want to see more of, and we need to spend time focused on that. So how will we measure that we are successful? So one of the things we want to really look at, and this was already mentioned before, is increase the number of participants that are taking the health risk screenings and the surveys and the HRAs, and just promote that and educate people about that and just try to increase those numbers. We're also going to, with our interventions, try to decrease in percent employed rate or number of risk factors that we see. We're kind of generalized it. We didn't focus on any one, but increase participation in our interventions that we'll be producing and promoting, and then promote the governor's health goal. Those are some of the things that we are looking at. Increase the people being involved in the government.
Yeah, so I heard increases.